Hi, my name is Dr. Christy Sadramelli, and I'm a pediatric pulmonologist here at Johns Hopkins. One of the most common conditions that I see and treat in my clinical practice, which includes both the clinic and the hospital, is asthma. This is, of course, not surprising since asthma is one of the most common conditions in childhood in the US. It affects about 6.5% of children under 18 across our country. And the prevalence in Maryland is similar, maybe slightly higher, but it's quite a bit higher in some places in our state, including Baltimore City, where I live and practice. In Baltimore City, it's closer to 1 in 4 children who have asthma, and in some neighborhoods, it's closer to 1 in 3. And not only is asthma more common in Baltimore City, it's more likely that children living in certain neighborhoods in our city will experience worse asthma outcomes. And this is concerning because asthma treatment has really come a long way. We have a lot of different inhaled therapies available now, and we also have asthma biologics, which are very helpful for children with severe asthma. They're injectable monoclonal antibodies. And while not everyone with asthma will need those, they can be really game changing for the people who do, both kids and adults. So, through my clinical practice, and just being a pulmonologist here in Baltimore City, I found that there were still gaps. We're seeing kids who are landing in the hospital more frequently than they should, and kids who are just not experiencing good asthma control despite the many tools that are available to us. And while this is a multifaceted problem, one small aspect of it is thinking about where kids spend much of their time, and that's the school environment. It's really common, not only here in Baltimore City, but around our state and really all around the country, for kids who are in school to not have access to their emergency medication. It's especially important to have access to this medication, which is often an albuterol inhaler, but there's other rescue medications as well. It's very important to have access to this during the school day because asthma attacks can come on suddenly and they can be life-threatening. So not only can they be life-threatening, they can lead to 911 calls. And even when they're not especially severe, if a child doesn't have access to medication in school, they may need to be sent home to receive their medication and miss the rest of the school day. This can lead to a lot of school absences, especially for kids with poorly controlled asthma. And it can also lead to more stress on the family, with parents having to take off work to deal with this sort of situation. So, fortunately, I had the opportunity to partner with some other investigators here at Johns Hopkins, doctors Michelle Eakin, Meredith McCormick, and Megan Schutte. They have an NIH funded research study based in 32 schools in Baltimore City. The study's called Asthma Champs, and they're working to improve asthma outcomes for kids in our city. I was able to partner with them because a new law has gone into effect, and it's really happening now. The law went into effect in 2024, and the policy's now been written so that kids in our state will have access to albuterol inhalers in school. So the typical process is that each student with any health condition, including asthma, should bring their paperwork and medication in at the beginning of the school year for the school health suite. This should still happen, but because we know it doesn't always happen, there are many kids at school who don't have access to emergency medication and are at risk. So a stock bronchodilator law, such as ours in Maryland, provides schools the ability to keep this medication on hand, in this case, an albuterol inhaler, along with disposable spacers that can be used as a background layer of safety for kids who are unable to complete the process and have their own personal paperwork and medication in place. This can lead to sooner treatment of the asthma flare-up, which makes it less severe. Often the child can return to class, but even if they aren't able to return to class, they're able to reduce the severity of their symptoms. So I've partnered with these investigators, and I've received my own funding from the Baltimore Breathe Center, the Thomas Wilson Foundation, and the American Lung Association to study the outcomes associated with this new policy. While we know it's good and safe for kids to have access to albuterol in schools, we are still learning best practices for the best way to implement it. And we don't have data outside of one or two other settings to see how much does it reduce school absences and what are the clinical outcomes associated with a policy such as this. So not only have my grants provided funding for me to help study that so that we can improve the implementation and reach kids the best way possible here in our city and state, but that we can help others around the country who are working to pass these laws or implement these policies. We can share what we learned here and they can use it in their settings as well. But with the grants, I've also been able to have enough funding now to purchase an albuterol inhaler and 10 disposable spacers for each public school in Baltimore City this year. I'm really excited about this because it's been a focus of my advocacy for many years now. And not only is it going into effect this year, I can help ensure that kids in our city will have access to this life saving medication during the school day. So, in closing, I'd like to thank my patients and their parents first and foremost, including those with asthma, as well as my clinical care partners. These are the nurses, the respiratory therapists, and the staff who support us. And of course, my research collaborators, the co investigators who are part of Asthma Champs, and the many study staff who support us. I'd also like to thank the school nurses and the school staff here in Baltimore City and across the state who have partnered with us. Thank you.